The eighth cranial nerve is called as vestibulocochlear nerve. So the detailed anatomy of vestibular nerve we have learned in the part 1 of this video. So the vestibular nerve and the vestibular pathway already we have covered. So here in this video we are going to learn the auditory pathway and the cochlear nerve in detail. The cochlear nerve is dealing with the sensation of hearing. So this is connected to the cochlear apparatus. This is carrying the sensory inputs in the form of auditory impulses. The first order neurons of the cochlear nerve, these neurons are located in the spiral ganglion and these are bipolar neurons. The peripheral process of these bipolar neurons are supplying to the spiral organ of cortex, and the central process forms the cochlear nerve. So these central processes are terminating in the dorsal and ventral cochlear nuclei, which are located in the brainstem. The second order neurons lies in the dorsal and ventral cochlear nuclei, and their processes are passing opposite to each other. Not all the processes, most of the axons are crossing opposite to each other, and these terminate in superior olivary nucleus. The third order neurons are located in the superior olivary nucleus. Their axons forms the lateral lemniscus, and these lateral lemniscus fibers are reaching to the inferior colliculus. The fourth order neuron lies in the inferior colliculus, and their processes passes through the inferior brachium in order to reach to the medial geniculate body. And the fifth order neurons lie in the medial geniculate body, and their axons form the auditory radiations. The auditory radiation fibers reaches to the auditory cortex, which are located in the temporal lobe, and these fibers are passing through the sublentiform form part of internal capsule before reaching to the auditory cortex. This is the schematic diagram to explain you the auditory pathway. So this already we have seen that cochlear nerve, its central process will be terminating in the dorsal and ventral cochlear nuclei of medulla oblongata. Further from this cochlear nuclei, the second order neuron arises, and that will be reaching to the superior olivary nucleus and also to the trapezoid body. And from this superior olivary nucleus, the third order neuron arises, and that will be passing through the lateral lemniscus to reach to the inferior colliculus. And fourth order neuron arises from the inferior colliculus in order to reach to the medial geniculate body of the thalamus. And the fifth order neuron arises from the medial geniculate body and passes to the auditory cortex as the auditory radiations. The clinical condition related to the cochlear nerve is deafness. So in deafness there will be loss of hearing. So there are two types of deafness: conductive deafness and sensory neural deafness. In conductive deafness, the sound waves may not be conducted properly to the cochlea. So the reason can be in the external ear or even in the middle ear. But in the sensory neural deafness, the reason can be the failure of transmission of the action potential due to the diseases of the cochlea or diseases of the internal ear.